We got Patrick Lonergan. Patrick's the Chief of Emergency Management and Fire. Mike Maltaverne, he is with the Bozeman City Fire Department, and also Matt Kelly, our health officer for Gallatin County. And thanks, guys, for joining us. We really appreciate it.
Hi, Dave. Thanks. Good to be here.
Yep, thank you, Dave.
I guess off the top, the first question we have is for the vaccine. It's my understanding there's just not enough of it, right? I mean, we're having a problem getting enough of the vaccine, which I think is a problem in most places right now, right?
Yeah, when you look at the world scale, there's just not enough supply across the world, let alone in the United States and in Montana. And while the manufacturers are working hard to, get out and produce as much vaccine as they can, we have what we have, and, we're getting an average of 1,300 doses a week here into Gallatin County across all of our providers, including the hospital and the university and the county and everybody else. So it's going to be a slow process at 1,300 doses a week, and our hope is that will improve over time. But at this point in time, we only have what we have, and we're getting what we get out as quickly as we can.
Is Gallatin County getting fewer vaccines compared to other parts of the state?
It is in some respects. I mean, I think some of that is coming from the state's vaccine dashboard, which really only tells part of the story. We're focusing on controlling what we can control here. So when we get vaccine in, we're getting it out, and we're having really good luck with our partners. But there are some differences in the way that vaccines are allocated for some pretty good reasons. We're watching that closely. Gallatin County has gotten a little bit less vaccine than some of the other larger counties, but there's a number of reasons for that.
Well, they're all two-step process, right? There's 2 shots that go with the vaccine.
Yeah, that's right. Right now, we have two brands of vaccine. We have Pfizer and we have Moderna, and they both require a second dose.
Are the shots free? How does that work?
So the vaccine itself is free, and if you show up at a point of dispensing that's run by the county, your entire experience will be free. Some providers will charge an administration fee to offset some of the real costs of having the staff and the facility and the organization to get it done.
Do you have a choice of where you go get the vaccine? Can you sign up for particular places?
Yeah, you sure could. There's a variety of avenues that people can go to, and the reality is
Oh, no.
Oh, sorry. We actually muted ourselves.
That's all right.
Anyway, yeah, so, you can come to the county, and the county ones are being filled a couple different ways in coordination with some of the providers, and they're identified patients off the 1B list. We're trying to open up, whenever we have a pod, a point of dispensing, the ability for some people to sign up first come, first serve on the internet. Bozeman Health is running them, and they're reaching out to their clients based on their underlying conditions and how they fit into the 1B criteria. The university's been doing similar things, as well as the communities down in Big Sky and West Yellowstone. So it's kind of a mixture of where you can go and kind of how those different entities are reaching out to their clients. And we're likely to see some changes as we move through here in the weeks to come, too. We expect that through a federal program, we'll see some of our pharmacies starting to get some allocation of vaccine. Exactly how you get registered for that and who that will be is yet to be determined. But the name of the game is everybody's working hard to get it out and we get it in. And it's a little bit of a variety in how you actually access it based on who the providers are that have it.
Dave, it's important to remember that so far the biggest partners in the county are coordinating really closely. The county is running a point of dispensing at the fairgrounds today, for instance. Bozeman Health will be having some clinics later on this week. Last week we saw CHP, Community Health Partners, working with Hubkin Basin Fire District in West Yellowstone. We've got Bozeman Health working with some partners and Big Sky giving shots. So there's shots going out virtually every day, and we're really trying to coordinate how we're doing that so that when we get the vaccine and we can get it out through multiple front doors in many communities in Gallatin County.
Now, you mentioned like the fairgrounds. You have to sign up for it. You don't just show up at the fairgrounds, right?
That's correct. And Dave, there's, just like Patrick alluded to, there's a number of different fronts to get signed up for those pods, and most of the 1B folks are being reached out to, like Patrick said, through a couple of different avenues. One point to make is that if a person just wants information and they want to be updated, a great service we've provided through the county's IT support is that we've got a notification system, and you can actually sign up for a texting notification. And what you do is you'll send a text to 888-777, and in one word you'll text in what phase you are in, whether that be phase 1B or phase 1C, and you're going to receive automatic notifications of status updates for the phase that you're in. And because right now everyone's starving for information right now, and that's just one way to stay in the loop, and we're updating that system as we have updates to provide.
And Dave, we're really trying to create multiple front doors for this vaccine, so it's important that people understand that just because they might not be successful, for instance, with the online system, we know that's created some frustration. Just because you're not successful there's going to be other opportunities. There's going to be more vaccines made available through the online system. We're working directly with healthcare providers, so you might get a call directly from your healthcare provider. We're also working with communities and with organizations in the community like senior centers. So we want people to understand that just because one pathway isn't successful for them, that's not going to be the only way they're going to be able to get the shot. And we're going to keep trying until everybody has a shot at it.
Now, my dad, he's in the 1B category. We signed up online a while ago, and we haven't heard anything. Do we expect a call, an email? Should we be doing something like going to the senior centers? What do we need to be doing?
My advice to people is just keep trying multiple pathways. If you signed up with the county and he's a patient of a healthcare provider, what we're going to be doing is sharing his information with his healthcare provider to let him know that he's interested in it. If we're going to work our way through that list, we're also going to be continuing to put up those sites. I would encourage people, even if you feel like you've expressed interest in it to the health department, try to get those online slots. And then as we move through this, there's going to be less demand because we're going to be able to give shots. And I think there's going to be more providers, as Patrick mentioned. I think we're going to see pharmacies be providers and those sorts of things. But right now, we're just really constrained on supply of vaccine, and that's really causing delays with some people who really want it.
Now, when it comes to the vaccine, do you get a choice of which vaccine you receive?
No, unfortunately, we can't do that. These points of dispensing are complicated enough. You'll get the same vaccine in your first shot, and your second shot will make sure of that. But it could be the Pfizer vaccine or it could be the Moderna vaccine.
I'm sorry, did somebody want to jump in there?
I'm just going to go back to the example of our parents and grandparents, and I would just urge the community, if you've got somebody that that falls into one of those phases, by all means, give them some support, help them out. A lot of the notifications are driven by technology, and we know that this demographic or the aged population may not be real tech savvy, but all those folks or most of those folks will have family or friends that could certainly lend a hand. And like I alluded to earlier, the text notification system, that doesn't have to be user specific. Somebody could sign up for those notifications and then pick up the phone and make a phone call to a parent or a grandparent to keep them in the loop. So we're really just asking for the community to reach out and support one another in these times.
We're talking with Patrick Lonigan, Chief of Emergency Management and Fire, Mike Maltaverne, he's with the Bozeman City Fire Department, and Matt Kelly, the health officer for Gallatin County. Matt, you mentioned there's the two different vaccines. What's the difference between the two of them, if any?
For all intents and purposes, for most people, there's not a heck of a lot of difference. They're both extremely effective. It's just a bit short of miraculous how effective these vaccines prove to be in the clinical trials. There is a difference in the time delay between the two vaccines, but we take care of that. When people come to get their first shot, we sign them up for the second shot to the right time delay. So you don't really have to worry about that even. We'll figure that out for you.
How long before the second shot?
With one brand it's 3 weeks, and with the other brand it's 4 weeks.
And with those shots, should you expect to feel a little, discomfort? Like, do you get sick a little bit?
Is there any soreness,
Yeah,
anything like that?
how does
Any
that
side
work?
effects?
It really differs by different people, but you should expect your body to react. You want your body to react to the vaccine, and so you might feel a little punky the next day, maybe even to the point where you might want to just spend a little bit of time laying on the couch. You might not have any impact at all. You might just have a sore arm. It really varies by the person. The important thing to know is that what you're after with that vaccine is your body to have an immune response. And so to have that feeling is a good sign that your body is working the way it should.
Should you be concerned if you don't have anything?
Not necessarily. I mean, I've gotten the influenza vaccine for years, and I've never felt anything afterwards. Other people have, so I don't think you have to be too concerned. That's a big part of the reason we have the 2 shots. With these vaccines, there's a significant efficacy for the vaccine. It works pretty well after 1 shot. But we're seeing that it's over 90% effective if you have those 2 shots put together, and so that's part of the reason you have those 2 shots.
Now, for you talked about effectiveness. How long is this vaccine good for?
We don't know that yet because it's such a new virus and it's such a new vaccine, so it's impossible to say for sure in the real world until we see how this works in the real world. We won't be able to. We know we can count on at least 4 months. I think it's going to be longer than that, but we won't know that until we have some time with this vaccine to study the effect on populations.
Hey, with coronavirus, is this something that's going to be like the flu in the sense that, every year we got to, get our shots or whatever, like it comes back every year, or do we wipe it out? How does that work?
Dave, that'll really be determined by what we learn about the vaccine and what we learn about people's lasting immunity to it. These vaccines are using new technology, so we have a lot of study to do to see how long. It could be that there's something like the flu vaccine, but it could be that it's a longer lasting immunity and you won't have to get it every year.
And then a couple more questions for you guys. One, what would you tell folks there are some people out there that are like, I don't know if I want to take this vaccine or not. What would you tell them?
Well, rather than saying a whole lot, I'd be really interested in listening. I'd be interested in hearing why they're choosing not to get the shot. Is it because it's a hassle? Is it because it's a new vaccine and they have concerns about that? What's the reason they don't want the vaccine? So that would be the first thing, and I think that has to be a genuine conversation and not just me making a speech to somebody.
Well, let me give you mine. This is why I would be concerned. It just seems like we didn't have the flu. We get those every year. I feel like it came up suddenly. Like in a matter of a year, they've come up with a vaccine for something we didn't even know really existed. That would be my concern. Like it was quick.
Yeah, I mean, it was. President Trump's administration really put a lot of resources into developing this vaccine. It went through the processes that we put the safety protocols and the testing and the data gathering. It is incredible that within a year we have a vaccine. What I would say to you, Dave, is the one thing that we want people to think about when they're getting the vaccine is that it can be more than just a personal decision for that individual. Those vaccines don't just protect the person getting the shot. They protect your loved ones and they protect the community by helping to slow spread. And the more people who we can get the shot and get that immunity, the harder it is for that virus to use us as to hitchhike in our bodies and move to other people. And by getting the shot, you can help us slow the spread overall, protect people in nursing homes, protect assisted living, protect hospitals, protect those businesses that we want to allow to operate in ways. All those things can be impacted if we can get people to take the vaccine.
Hey, Dave?
Yeah, sure. Go ahead.
On the question about the speed at which the vaccine was developed, or Pfizer or Moderna, it's actually kind of interesting. So the CDC has a program where they try and figure out what might be the next pandemic that can affect the world and so forth. And prior to this pandemic, several years beforehand, they had identified that a coronavirus was a high risk for causing a pandemic in the future. And so they had actually started working years ago with Moderna on developing a generic coronavirus vaccine. So I was reading an article about this last weekend, and it was talking about how the CDC worked with Moderna to build the basis of a coronavirus vaccine. And so then when this one broke out in the world, they just had to tweak it and modify it a little bit to meet this particular coronavirus. So I thought that was kind of interesting. Kind of goes to the question of how do they do it so fast? Well, they kind of already started working on it years before.
Now, when we were talking about folks who are a little hesitant about taking the vaccine, Matt Kelly, you mentioned that it would depend on what their concerns are. What about those who are concerned about long-term effects of the vaccine, unknown health consequences, including fertility, that could be affected by the vaccine?
Yeah, I think those are questions that people should have those conversations with their healthcare provider. And everybody has a different health circumstance, and they should talk to their healthcare provider and have those genuine conversations. I think healthcare providers are ready to have those conversations. I'm not ready to dispense medical advice to everybody over the phone, but I think it's important that people be heard and have those conversations. I can tell you I have confidence in the vaccine. When it's available to my family, we'll get it, no questions asked. We haven't yet, but we're sure eager for that, and I have no qualms about that. So I think those are concerns that everybody should work through with their individual healthcare provider, but know that these vaccines have gone through rigorous safety studies and effectiveness studies.
Who is able to get the vaccine right now? Like, what's the order that we're going in?
So Dave, we've moved through 1A, and we're taking a pretty good dive into the 1B population. And just to continue to reiterate, just as quick as we can get the shot. So those are the folks that are over the age of 70 with some other health complications, and then people of color and American Indians.
And it's my understanding, too, no kids are getting this right now, correct?
That is correct, yep. And, just to kind of go back a little bit in terms of the hesitation of getting a vaccination, or those that either may wait a little while to let this thing run its course, or those that elect to not get the vaccination, or those that just aren't quite eligible yet. And we're going to continue to beat the drum of keep doing what you're doing, continue to wear face coverings, continue to practice social distancing, and also good hygiene, and knowing that this is going to be more of a marathon than a sprint. And I respect those folks that are waiting, and we just know that it's a supply problem and not necessarily us getting them out the door.
Now, with the supply problem, you mentioned the 1B category. That seems like a very large category. Is there any priority when it comes to that versus an older population gets the vaccine first, or a certain demographic, or is it just first come, first serve?
We kind of started down that road a little bit with the over 80 population, and what we found is the more times that we sliced up this 1B, we were almost overcomplicating it. And basically, we just want to make the vaccine eligible to those people that fall into that 1B category. So it's like the same methods that we've spoke to in terms of we're reaching out, we're capturing their contact information, we're putting out ways for them to be notified. And so basically, if they meet 1B, it is somewhat of a first come, first serve, or they're being reached out if they provided their information to their provider or signed up to the county.
Is there any sort of timetable that you have of like when everybody could possibly be vaccinated here in Gallatin County, like end of summer, before summer?
Next year?
Yeah.
If you do the math at an average of 1,300 a week, that's not good, right? When we're looking at approximately 114,000 people that reside in Gallatin County. However, we are kind of at the end of the whip, right? So we've got the federal government is obviously pushing on the drug manufacturers to make the vaccines as fast as possible. We know that they're being pushed out to the states, and then the states are pushing them down to the counties. So we're kind of at the end of that supply chain, but we are definitely confident that there's a tremendous amount of pressure being put on the manufacturers to crank out more vaccines. So I would say, in the future, we're going to see those allocations to the counties, hopefully significantly increase. And it's good to know that we do have a great system that's been humming along here. And as quick as we get the vaccines shipped to us, we're getting them out the door. We're not sitting on trays of these vaccines that are sitting in freezers or anything. Everything that we get goes out the door, and we get them out to these clinics or these pods, and we're dropping shots in arms. So, our crystal ball is we're hoping what we're hearing all the way to the federal level is that we're going to start to see more allocations coming soon.
All right. Go ahead.
I was just going to add, there's other manufacturers about ready to, or working on getting approval for their vaccines. So Johnson & Johnson's probably the next closest one to come on board. So, their projection for commitment to the U.S. government would probably add like 50% to our allocation if we got a third vendor on board. So hopefully that'll help increase our ability to give vaccines too.
We're going to get there, Dave. It's going to take some time. It's going to be months, not weeks. That's why it's important that people really continue to do the things that slows down transmission. We can't rely totally on the vaccine. We have to keep social distancing. We have to keep wearing our face coverings when we can't socially distance. We have to keep staying home when we're sick, washing our hands, doing those things that we know slow down transmission.
Hey, Matt, since we have you, one final question. Man, we could have done an hour on this. I wish we could. One final question for you in regards to COVID-19. It seems like things are looking pretty good and have been here for a while. What is your assessment on that?
I think locally our epidemiology is looking really good compared to where we were in November, but it was pretty awful in November. We were putting a lot of people in the hospital. We had a number of deaths happening. It was pretty significant and pretty scary in November. It's definitely improved since then, and I think the people of Montana and Gallatin County deserve a lot of credit for that. I think the other thing that we're watching out for is on the horizon. We're seeing what's happening with the variant strains of the virus in parts of Europe, and some parts of Europe are seeing really widespread contagion right now, and to the point where they're having some lockdowns in Europe because of that. So we're optimistic, but we're cognizant of the fact that this could get worse. There are some epidemiologists that think the U.S. hasn't seen the worst days yet. We just don't know. We're trying to be prepared one way or the other.
All right. Hey, guys, thanks for joining us again. We could have done a whole hour on this. I wish we had the time. Patrick Lonergan, Chief of Emergency Management and Fire, Mike Maltaverne, he's with the Bozeman City Fire Department, and Matt Kelly, Health Officer of Gallatin County. Real quick before we go, I guess in the county website, the health department's website is where all this information is.
Yep, healthygallatin.org.
Okay. All right. Hey, thanks again. We appreciate your time today.
Thank you.